Welcome back. It is 7:23. We have just learned some pretty important data on the coronavirus in central Indiana. Indianapolis-based HC1, a company that does precision testing, used information from an Eli Lilly drive-through testing site to come up with these findings here. And joining me live is Chairman and CEO of HC1, Brad Bostic. Brad, thanks for checking in with us early this morning here. Let's talk about what it is that you studied here. You took information from testing that was done early on in the pandemic, early April and late May, 14,000 responses here. Tell us about who you tested and what you discovered.
Well, in this case, HC1 really utilized our expertise in transforming lab data into personalized healthcare insights, which is actually something that we do across the nation. We've got over 20,000 lab testing locations that are plugged in securely into the HC1 platform. And an opportunity came up to partner with Lilly, who has been doing drive-up testing for vulnerable populations, so people with pre-existing conditions that make them more vulnerable to the virus and its effects, and then also first responders. And so we were able to look at details like what are the symptoms that are most prevalent when you show up with a positive test, what percentage of people based on their job type were coming in with positive coronavirus tests. So that's been the focus of this.
And I think a real key finding here that I think a lot of people will sort of lock on to, and that is one of the predominant symptoms of people who had a positive test. They had a loss of taste or smell. That was the most frequent indicator of an infection here. How prevalent was that?
Yeah, it was 33.7% of the positives showed that they had this loss of taste or smell, which is fascinating. We're seeing a lot of people who are otherwise asymptomatic, actually. So really, if you're out there, going about your normal day and you find that all of a sudden you can't smell or taste normally, it's very important to get a test done.
Here's some of the other symptoms. 6 really came to light here. Coughing was the other most common symptom, but shortness of breath, which we've heard that a lot, was the least common. What does that tell you about being able to predict cases among those who aren't showing any symptoms?
Yeah, well, the issue with coughing, it seems kind of clear that might be something, but when it's nearly 61% of people have these coughing, kind of this dry cough going on, as a symptom when they show as positive. And it's only about half of those, about 31.5% of people had shortness of breath. And I think it's just a matter of the progression, most likely, of the disease, where it's a bit longer before you start having some of the compromised lung issues. We also saw that nurses actually tested positive twice as often as the actual physicians did. Wow. Which shows we need to do more with PPE and different techniques to help protect our healthcare workers.
Last few seconds before we have to wrap up, Brad, what do you do with this information and how can we specifically benefit from it maybe longer term?
Yeah, the biggest thing with this is just to help these vulnerable populations, these first responders, do everything possible to keep them safe and prevent the infection. And then ultimately just working with all of this insight across the country to help employers get people back safe into the workforce and help their customers can, feel safe and remain healthy as well.
Thanks for doing the work that you're doing, Brad. Thanks for taking the time to share it with us, and stay healthy and best of luck.
Thank you so much. Take care.
All right, you too. Have a good weekend. If you want to take a closer look at that data here, as I said, it's dense. There's a lot in it, but there might be something there that you'll find very useful. Fox59.com is the place to go in our links section. Jess?
Pretty fascinating look there, Ray. Thank you.